Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. While public opinion on vaccines remains split throughout the country, a COVID shot for young children may be on the way. Here to discuss the latest on vaccines is Dr. Brenda Anosike, Pediatric Infectious Disease Specialist for the Children's Hospital at Montefiore. Doctor, thank you so much for joining us.
Thank you so much for having me.
So, vaccines remain a controversial topic, but now there's a Pfizer vaccine that could be approved for young children. What are your thoughts on the vaccine expanding to much younger patients?
I think for many people, this couldn't have come fast enough. While we initially thought that COVID did not affect younger children earlier in the pandemic, I think that's becoming less apparently so, as this is no longer the case. Children are getting infected and they're sick. And particularly now with children, now we're seeing that thousands are being hospitalized, likely due to the highly contagious Delta variant, and hundreds have died just in the past few weeks over the time in the pandemic. And then I think the second thing is that originally we thought that children were not spreading the disease, but in fact they are, and they can do this whether they're having symptoms or not. So it becomes an important thing where the vaccine becomes a important arsenal in our fight against COVID.
So I like that you mentioned that children can be affected because for a very long time we've been hearing about seniors or people with pre-existing conditions. Can you just compare, does it look different in a child versus a senior or someone with a pre-existing condition?
Yeah, that's a great question. I think it's not it's for children. The range is quite expansive. They can be well appearing to having very mild disease, very similar to adults as well, to having very severe disease, and in fact have significant complications, life-threatening complications. So it's not very clear as to who is more at risk than others, except in particular patients who are high risk conditions, immunocompromised conditions. But for the most part, children are not discriminated in terms of this infection as are adults.
Now, according to CNBC, Pfizer submitted initial COVID vaccine trial data to the FDA for kids ages 5 to 11. I'm curious as to why it starts at 5 and not younger. Do issues arise when you vaccinate children younger than 5 years old?
Yeah, I mean, the trials that are going on right now, in fact, are involving a number of age groups. And just that the data for children between 5 to 11 is out. Currently, for example, Pfizer is running a separate trials for the COVID vaccine in children's 5 to 11. That's what we know about so far. But they're also running it from children ages 2 to 5 years of age, and also children's from 6 to 2 years of age. And the difference is because they're looking to see how the vaccine at various different doses for those specific age groups, how it changes for the different development and growth of those specific age groups. So that's the reason why there is nothing out per se on children less than 5, but the research is certainly ongoing.
Now, are these children getting a completely different vaccine from those that are 12 years and older?
No, the vaccine is actually quite the same. It's actually identical to the adults. And in fact, the ones that we're giving to children from 12 to 15 years of age. The only difference is that it's the dose. We all know that children are not small adults, even though some children want to act like adults, but they're not. And so we want to make sure that the doses are appropriate for the child, safe for the child, giving the minimum side effects for the child.
Now, what is this process expected to look like? What can parents who have very young children expect to happen when they eventually possibly go in to get their child vaccinated?
Yeah, this is a rigorous scientific process that the FDA, the Food and Drug Administration, takes extremely serious. There are scientists who look at the data that is presented to them by the companies such as Pfizer, Moderna, of the likes, and they really look to see, they screen out and sift out anything that could be potentially be missed by the companies when they were reviewing the data themselves. And so we know that children are our babies. And so we want to be absolutely sure that we're not making any missteps. And this may be a process that takes a while, but usually avoids any sort of issues in the long run.
Now, many of us know the concept of vaccines for kids has always raised concerns. It's always been very controversial. And it's been that way since before the pandemic. Why do you think some parents are hesitant to vaccinate their children?
Yeah, I mean, I think despite the evidence that the vaccines are safe, the truth of the matter is that most parents are just worried. They're worried, and understandably so. And I think it's a fear of what is not known, the newness of the vaccine, the speed at which the vaccine came into the market, and just not knowing what the future outcomes are. So it's understandable where parents are having some questions about that. But from our experience and from my experience is that parents want to know more, and so it is our job as pediatricians to do just that, provide them as much information as possible.
And so I like that you kind of touched on a little bit. I wanted to say, what are some ways people can combat that, whether it's, a friend who may be a little bit on the fence or, a doctor, how can people combat this?
Yeah, I think having to speak with someone you trust that you're comfortable with. Your pediatrician can be certainly a first line, but also a trusted member of your community as well that has the knowledge. Even a family or friend who has been through the vaccine and their children have received the vaccine, that might be helpful. We want to just keep the conversation non-judgmental, understanding and recognizing the doubts and the concerns that parents have as well, because it's a shared decision making process that overall impacts the care of your child. And so we just want to make sure that they feel comfortable, who they're speaking with.
Now, if the vaccine is approved for younger children, what will that mean for safety in our schools?
I think as a pediatrician, our primary goal is to do what's in the best interest of our kids, and that's really to be safe and to be in school, learning in a comfortable setting. So whatever we can do to try to create that it would be important. And vaccine is certainly a good step in the right direction to do that.
Now, I want to know just from your experience, does the idea of a vaccine coming from children, does it make things easier for you as a pediatrician?
Yeah, I think so. And I think it's because it sort of removes a lot of the concerns that parents have. As I mentioned earlier, that the COVID virus, it has the propensity to spread amongst gatherings. And the school setting is certainly not a setting that we would want to miss. So I think having to have that as an arsenal, the vaccines, it sort of mitigates the risk of spread in a school setting and also prevents the child having to have long-term complication as it relates to the infection. So that helps us as pediatricians because we can avert some of those things. They don't have to see me after the fact. We can now do things more preventative.
Now, young children aren't the only ones who are going to be receiving a shot. Booster shots have been added to the current set of vaccinations. What is the booster shot and who qualifies for it?
Yeah, the booster shots is essentially just an additional COVID vaccine shot outside of the two-dose series, and it is intended to enhance the body's immune response to the virus. There are certain populations that are currently approved to receive the booster, not children just as of yet, but usually the more vulnerable populations. Currently, now it has been approved in those who are more than 65 years of age, those who are 50 and have medical high risk conditions, and then also in those who are greater than 18 years of age who live in a long term care facility or they're immunocompromised. And then also those who are working in the front lines, i.e., healthcare providers. So the CDC has a really well laid out list of those who are considered to be high risk persons that can receive this booster.
Now, I just want to add that I know a lot of people, this was a big step for them to get the vaccine. Why is there a need for a booster shot on top of that?
Yeah, that's the question. So I think the reason is because, as we all know, this pandemic has really had ever changing moments, and we're doing our best efforts to sort of beat the curve and beat the surge, so to speak. And with the new variants that are out there, and with the new populations of patients that it's affecting, we're learning more, we're doing more, and we're having to do things that are necessary to try to keep abreast of what's going on. The booster shots are not a new phenomenon. We see it with other childhood vaccines that we've all received. We've gotten the pneumonia vaccine, we've gotten the hepatitis B vaccine, we've gotten the polio vaccine. These are all vaccines that we've used boosters for, and all of which are things that we don't even talk about because of how effective they are.
Now, the addition of booster shots have given some anti-vaxxers more confidence to say regular vaccines don't work. Can you just explain briefly the science behind that and, just what are your overall thoughts on that idea?
Yeah, so no one vaccine is 100% effective. We would like it to be, but it's not. And so, again, doing our best efforts to try to follow what the organism is doing, the virus is doing, such that we can cover our bases for it is really the goal. And the goal really here is perhaps it's obviously the first thing is to prevent transmission, but the major goal that we're looking here is to try to avoid severe disease. And that's what this vaccine has demonstrated thus far. It prevents severe disease and also hospitalizations and even death. And so that is really what our main specific goal is for these booster vaccines, while we're trying to learn more as time goes by to make these vaccines a lot more effective.
Now, where can people go to make sure they're making the best decisions for their families in regards to vaccines and boosters?
Oh, I would say the first line, no dig to me as a pediatrician, but definitely your doctor. Go and see your doctor. I've had the same doctor for many, many years myself, and is someone whom I trust. And I would say that would be the first line. And then perhaps your provider, if they're not able to provide the information by themselves, they can certainly be able to provide you resources online or in your community.
All right. Well, doctor, thank you so much for joining us.
Thank you.
We'll be right back.